In some cultures, a baby dying is a common thing. You don't name your babies for certain periods of weeks or months because you don't want to give the child a name because you think you're going to lose it. People are dying of incredibly preventable diseases all the time. In Tanzania, one woman is dying every hour from a complication of pregnancy or childbirth. We don't see those numbers remotely here in the United States because of the lack of resources. Half the time there's no medications. These are patients who don't even have an emergency room that they can walk into in the times of most dire need. It's an incredibly dire situation. Things that we know well in a country like the United States, we can bring that expertise and support to many of the places that we work. The program now works in 5 countries, 34 sites, and we've sent 155 volunteers over the last 4 years. Some of the success we've seen is not only just in the 8,300 health professionals we've helped train, the successes are certainly in the stories. One of our volunteers, within 6 hours of arriving at her site, she walks into the theater and she sees a pregnant woman who's about to undergo an operation who's effectively dying. And she realizes she can't save the mother, but she tries to save the babies, and she loses them too. She's devastated by this, and the next day she says it happened again. Only this time she was actually able to perform the life-saving surgery that saved this mother's life, and this is a mother of 5 children. And then she taught her counterparts how to do this same life-saving surgery so that when it happens again, they're now empowered to save people. And that mind shift and empowerment of her colleagues was really profound. That's what we're trying to do. There's a responsibility to be engaged and to give back, and I hold that really dear. There is so much need in the world, but there doesn't need to be. And I think we can bridge that divide if we really band together and we're smart about how we engage the world.